Urgent contact tracing is continuing after a woman who worked at a Sydney quarantine hotel contracted COVID-19. Reporter Alexia Atwood has more from Sydney.
Urgent genome sequencing and contact tracing is taking place to figure out if this woman actually picked up the virus while she was at work or if she picked it up in the wider community. And there is that little bit of doubt because it's understood that she didn't actually have any direct contact with anyone who has had the virus who's staying at the quarantine hotel that she works at. And we are still waiting on those results. We're told 24 to 48 hours still. Anyone who caught public transport with this woman while she was potentially infectious between the 27th and the 30th of November, they're needing to go into isolation, and this is affecting thousands of people. So these are people on train routes between Minto in Sydney's southwest, changing at Lidcombe, going to Central, and a couple of light rail routes in the city as well. So you can go onto the New South Wales Health website to see the times of those services to see if this is affecting you. And usually what New South Wales Health does is that they just say anyone on the same public transport routes needs to monitor for symptoms. But in this situation, they're just taking such a precautious approach until they get a better understanding of the situation, and then they might downgrade that need for everyone to be in isolation for 14 days. It's very much a wait and see situation.
Okay, so the staff at quarantine hotels are meant to get regular testing. Is that happening?
No, it doesn't sound like it is happening. On November 18th, all states and territories agreed at National Cabinet that there would be this policy where all staff working at quarantine hotels got mandatory regular testing. And that was to really try and step up the surveillance of this system. And if we could continue to be allowing people to come back from overseas into Australia, that we would need to step up the checks and balances, especially after what happened in South Australia. But it's been revealed that this hasn't actually been rolled out across all Sydney quarantine hotels yet. New South Wales Health says they are working with police to try and roll this system out as quickly as they can in these police-run quarantine hotels. But questions have been raised about why it's taken so long to roll out this system, and if we did have it in place, would it have actually picked up this case sooner? We don't know.
Yeah. And could this case have impacts on restrictions or borders?
Again, Joe, there's a lot of unknowns here, and the answer is still very much unclear. It's a combination of things as well. There's contact tracers are working incredibly hard to just see how wide-reaching this outbreak could be, if at all. And there's also a lot of community responsibility involved here, because people need to step up that testing, especially in the southwest of Sydney, where this woman comes from. And also people should really think about wearing masks, the government says, on public transport, because this woman, she caught public transport a lot. So there are lots of factors determining, how far this outbreak could be. But the New South Wales government says that they're happy to continue with their plans to ease restrictions as of Monday. But the Premier, Gladys Berejiklian, says that if the health advice dictates, that she won't be afraid to tighten up those restrictions again. And WA also says that it's watching the situation very closely, and it's going to take a few days to decide whether it's going to proceed with the plans to reopen the border on December 8th. It's very much a moving situation.